Certified Nursing Assistant 2026 CNA Certification Exam Full Course Basic Nursing Skills. Question 1. What is the medical term for high blood pressure, hypotension, hypertension, tachycardia, bradycardia? Hypertension is the term for elevated blood pressure. Question 2. If a resident's intake is 240 ml of juice and 120 ml of water, what is the total intake? 300 ml, 360 ml, 400 ml, 480 ml. 240 plus 120 equals 360 ml. Accuracy in INO is vital for monitoring fluid balance. Question 3. Which of the following is an example of objective data? The resident says they have a headache. The resident's temperature is 101.2 degrees Fahrenheit. The resident says they feel nauseous. The resident says they are tired. Objective data is measurable or observable, signs, while subjective data is what the resident tells you, symptoms. Question 4. What is the first sign of a pressure ulcer forming? A deep open wound. Skin that is red and does not turn white when pressed, non-blanchable. A black scab. Bleeding. Redness that doesn't blanch is a stage 1 pressure injury. Question 5. When making an occupied bed, the CNA should keep the resident covered with a bath blanket for privacy. Raise the bed to the highest level and leave the side rails down. Shake the dirty linens to get rid of crumbs. Place dirty linens on the floor. Dignity and privacy are maintained by using a bath blanket during the process. Question 6. To convert ounces, Oz, to milliliters, ml, you multiply by 10, 20, 30, 50. 1 ounce is approximately equal to 30 ml, or 30 cubic centimeters. Question 7. A resident who is NPO is allowed to eat only clear liquids, not allowed to have anything by mouth, allowed to eat whatever they want, allowed only water. NPO stands for nil per os, meaning nothing by mouth. Question 8. Which position is best for a resident who is having trouble breathing? Supine, prone, Fowler's, upright, lateral. Fowler's position allows for better lung expansion. Question 9. What should a CNA do if a resident's pulse is irregular? Ignore it. Count for a full minute and report it to the nurse. Wait an hour and check again. Tell the resident they are fine. Irregularities must be monitored for a full 60 seconds and communicated to the nurse immediately. Question 10. Dysphagia means difficulty with speaking, walking, swallowing, urinating. Residents with dysphagia are at high risk for aspiration and may need thickened liquids. Question 11. A clean catch urine specimen requires collecting the urine from a bedpan, cleaning the perineal area before collecting the midstream urine, collecting all urine for 24 hours, a catheter. Cleaning and catching the middle of the stream reduces contamination from skin bacteria. Question 12. Where should a CNA stand when helping a resident with a weak side to walk? On the resident's strong side, on the resident's weak side, behind the resident, in front of the resident. Standing on the weak side allows the CNA to provide support if the resident begins to stumble. Question 13. Which of the following is considered a vital sign? Weight, height, blood pressure, bowel movement. The 4 main vital signs are temp, pulse, respiration, and blood pressure. Pain is often the 5th. Question 14. When recording fluid intake, 1 cup is equal to 120 ml, 240 ml, 300 ml, 500 ml. A standard 8 ounces cup is 240 ml. Question 15. Log rolling is a technique used to turn a resident who has a broken arm, a spinal cord injury, diabetes, a sore throat. Log rolling keeps the spine in alignment during the turn. Question 16. A sitz bath is used to wash the hair, soak the perineal or rectal area, clean the feet, treat a fever. Sitz baths provide heat and cleansing to the pelvic area. Question 17. The normal temperature for an adult taken orally is 96.6 degrees Fahrenheit, 98.6 degrees Fahrenheit, 100.2 degrees Fahrenheit, 94.0 degrees Fahrenheit. 98.6 degrees Fahrenheit, 37 degrees Celsius is the average normal oral temperature. Question 18. Edema is the medical term for a bruise, swelling caused by excess fluid in the tissues, a type of skin rash, high blood sugar. Edema is commonly seen in the feet and ankles of residents with heart or kidney issues. Question 19. A 24-hour urine collection starts by saving the first urine of the morning, discarding the first urine and then saving all urine for the next 24 hours, collecting only 100 ml of urine, using a sterile container. The first void is discarded to ensure the 24-hour period starts with an empty bladder. Question 20. How often should a resident's intake and output be totaled? Every hour, once per shift, once a week, every 24 hours. INO is usually totaled at the end of each shift and then summarized for the 24-hour period.